I'm Dr. Robert Harper, back to talk about adult degenerative scoliosis. In general, it's a fairly asymptomatic condition, and there are some papers that suggest up to 50 or 60% of people have some degree of adult degenerative scoliosis as the population ages. When we first encounter somebody in the clinic, first we go based on symptoms alone, and then we get a set of x-rays. That shows us what the overall alignment of the spine is, both in the frontal plane so that we can see curve like this, but also more importantly, we check it in the side plane so that we can see how able someone is to keep their head above their pelvis, which is one of the main problems with adult scoliosis. If they're experiencing neurological symptoms, that might mean weakness of the legs or numbness or tingling of the legs or pain that runs down the legs while they're walking, we would get an MRI. And the reason we get an MRI is the x-rays can show the bones really well and show overall alignment, but it really can't show nerves or soft tissue. So we just need to get an additional image to look deeper within to see if there's any pinching that occurs with the scoliosis. In general, for mild cases, which include back pain with activity, we can really work on activity modification, or more importantly, we work really hard with our physical therapists here to work on posture, to work on gait, and more importantly, to work on core strengthening. And that allows people to strengthen the muscles around the spine and strengthen the muscles around the core to work to keep their posture correct and keep their head above their pelvis. We reserve surgical treatment for those who have the worst symptoms, which involves really not being able to walk or participate in daily activities. That includes cooking, cleaning, shopping, taking care of oneself. For especially women, we also will measure bone mineral density and we'll work to treat osteoporosis before we consider any surgical treatment. Smaller procedures, those are often just a day or two in the hospital. For the larger reconstructive procedures, that involves a longer hospital course, and that may be 5 to 6 days in the hospital, sometimes treatment or rehab facility, and then dedicated physical therapy once they've recovered. This is Dr. Robert Harper with the Colorado Springs Orthopaedic Group, here to take care of your needs. If you're having severe low back pain or pain that runs down the legs, please give us a call, and we have all the members of our spine team ready to take care of you.